Hi everyone, this is Dr. Launice, author, speaker, baby doctor, and I take care of sick babies for a living. And I like to help tired, stressed out moms who have babies in the NICU by letting you know more about it, what to expect, and kind of what's going on. So check me out on Instagram, follow me on Twitter, like my Facebook page, check out my other videos. But today I want to let you know 4 things that you need to know when your baby is admitted to the NICU. Okay, so let's go. So first thing that I want you to know is after your baby is delivered, whether it's a baby who is full term or it's a preterm baby who we know is going to need to come to the NICU, it's going to take us a little while to get your baby settled in the NICU. So usually, depending on how sick or how stable your baby is, it could be anywhere from 30 minutes up to an hour, which I know seems like forever. So a lot of times you have parents who are anxious and they're kind of calling down multiple times because they want to know an update, they want to know what's going on. But really, in that first hour, we're just trying to get your baby settled and trying to make sure that everything is going okay. So if we tell you, after we stabilize the baby after delivery that your baby needs some kind of breathing support, like maybe if your baby has a breathing tube in the airway to kind of help them breathe, then after we get the baby settled in the NICU, we have to put the baby on the ventilator. We have to make sure that the settings are right. If your baby's sick enough, to need breathing support, more than likely, especially whether full term or preemie, we're going to want to put some special lines in the baby's belly button that helps us to give them fluid and to get labs from the baby. So I did a video on that called Lines and Tubes Oh My on Periscope, so check that out, where I talk more in detail about the types of lines. But basically, we're going to need to put in some small catheters through the belly button. And when we do that, it has to be under what we call sterile conditions. And that just means that we want to make sure that we do it very safely, and we want to make sure that everything is very clean. So we use special things to make sure that we clean the site. Anytime you're going to introduce something that's foreign, right, that's not part of the body, into a blood vessel or something like that, we want to make sure that we do it in a clean and safe way so that we decrease risk or any chance of infection. So when we do that, the nurses who are helping us, the doctors or whoever might be doing the lines, we have on a hat, we have on a mask over our face, we have on a gown, we have on gloves, we have on all these different things to make sure that we do it safely. And that's one of the reasons why we don't have parents in the room when that's happening. So it takes us time to do that. Especially for our small babies, sometimes they can drop their blood sugar if they're not getting enough fluids right away. So we may have the nurse put in an IV real quick before we start to do those lines in the belly button, because that takes a little bit longer. So by the time we kind of get all that stuff done, once we have the lines in place, then we have to get an x-ray, right? We have to take a picture so that we confirm where it is. If we have a breathing tube in the airway, we want to make sure it's in the right place to make sure that we're getting adequate, support and oxygen and air to the lungs. We want to make sure that our lines that we put in through the belly button are in a good and a safe place so that we can start giving fluids. So by the time we do all that, get that all set up, do our x-rays, before you know it, it has been an hour. So I know you're anxious, but that's kind of what's happening in that hour. And if you were down there, there'd be so many people in and out of the room. And so it just makes sense to know that you're going to need to wait for an hour. And then when we're done, we'll absolutely give you a call to let you know now's a good time to come in and see the baby. Or, if it's a C-section and we know mom's not going to be able to come down, then usually the doctor, whoever, will come up after doing all that stuff to kind of give you an update then and let you know how things are going and let you know that, baby's doing well or what the status is, and then say, hey, now is a good time for you to come and visit. So that is the number one thing I want you to know first. So the second thing that you should know after you have a baby admitted to the NICU is that really when you're coming down, right, after you have a baby that's in the NICU, like a preemie for all the time, this is just going to be routine for you. But you have to wash your hands just like everywhere else. It's so important, right? So you have your baby in the ICU. That's the intensive care unit, right? We take care of sick babies, and we have babies who are 23 weeks all the way up until babies who are full term, right? So we have all kinds of babies who are vulnerable. And so we want to make sure that everybody who's coming in, we want to make sure your baby's safe and every baby that's in the NICU is safe. So it's always important. First thing when you get there, you want to wash your hands very well. A lot of places, they'll have a place to wash your hands before you ever get inside of the NICU or just after you enter, or whether it's right outside your baby's room. It's just important, especially as we're now in the middle, kind of a flu season and RSV season, which is another sort of viral infection that kids can get if you have other small ones at home. And so we just want to make sure that we're keeping our babies protected. And it's also important to remember this, right? So it's exciting, right? New baby's born. Everybody wants to see the baby. So you come in and see the baby, then you have to go out and then let another family member in because you only have so many visitors at a time. Just remember as you're going in and out that each person needs to wash their hands, and that's really just to keep baby safe. All right. So that's the second thing I want you to know. The third thing that I want you to know and remember is, okay, so your baby may have been sick, okay, your baby may need breathing support and has these lines in through the belly button. So I just kind of want you to know, what is baby going to look like, right? So again, for our preemies, or sometimes even for our bigger babies, if they're sick, they may be on a warmer so we can give them heat to make sure that they help maintain their temperature, or sometimes they need to be in that isolette, right? That's that kind of plastic box that you see the babies in when you go into the NICU. And that helps them to keep their skin warm because they work hard to do that. They expend a lot of energy at trying to make sure that their temperature stays warm. So we help them out by putting them in the isolette. So when you come in, your baby's going to be inside the box, right? You might see little wires going across the chest with looks like little stickers on the chest, and they plug into the monitor. And that just, you don't need to be scared about that or worried about that. That just lets us monitor baby's heart rate, their breathing rate, and make sure that, we can tell that the oxygen levels are okay. You're going to see those lines that I talked about going in through the belly button. Okay. And then if your baby's on any kind of breathing support, you might see, right, the breathing tube and tape kind of around their mouth so we can secure it in place. And that might be hooked up to the ventilator, or they might have cannulas in their nose. You might see tubing going up to that to make sure that it's connected to the breathing support. So there might be a lot of stuff going on. So just kind of prepare yourself for that. When you come in to see baby, that we're going to have a lot of different things going on, which is why it's very important that we need that hour to get baby all set up and settled before we have you come in to see baby. And then then you'll get a chance to see baby. We have there's little holes, right, along the doors on the isolette so that you'll still be able to open it up and you can touch your baby and things like that. But just know we have all these things in place to kind of make sure that your baby's breathing okay, that they're getting fluids, and that we can monitor them and make sure that they're warm and that they're doing okay. So that is the third thing that I want you to know. Fourth thing that I want you to know is you kind of want to find out what time during the day your team is going to round on your baby. So most everywhere will usually do it sometime in the morning, and you kind of just want to ask what time rounds are going to start, okay? And that's why, the reason why is because you get to meet everybody that's going to be on the team taking care of your baby at one time during the day. And so a lot of places will do what we call bedside rounds, where we go to each room and we talk about the baby, we meet the parents, you get a chance to ask questions, you kind of hear us talk about the plan for the baby, and kind of let you know everything that's going on. So you kind of want to ask, what time that starts, so that if you're able to be there, that you can be there. If you're not, always know that you can always call and get an update on how your baby is doing, right? You can call and ask the nurse certain questions. You can call and ask to speak to the doctor or to the nurse practitioner or physician assistant who's taking care of your baby to kind of get any results or get any updates if you're unable to make it down for the rounds, because we know that sometimes parents aren't able to do that. So I don't want you to feel like if you don't make it during rounds that you can't get information on your baby, because that's not the case. But that's kind of the best time to sort of hear what the plan is for the baby, what the new information is, and who's going to be there at that moment helping you take care of your baby. So those are the quick tips, the quick 4 things that you know after baby is admitted to the NICU. The first one is it takes a little bit to get your baby settled. So sometimes it's a half an hour or an hour that, we kind of need to get baby settled before we say it's okay to come to the NICU to see the baby. Second thing is always, we want you to wash your hands to keep your baby safe, okay, and decrease any chance or risk or spread of infection. The third thing is just to be aware that your baby is going to have, monitors, leads on their chest so that we can monitor how they're breathing and how they're doing, and may have some lines and equipment and things in the room, and that's okay. That's all just monitoring and making sure that your baby is doing okay. And then the fourth thing is you want to find out what time rounds are. So it's the best time to meet your team and kind of find out what the plan is for your baby for the day. So those were 4 quick things that I think you need to know after baby is admitted to the NICU. Once again, this is Dr. Launice. I take care of sick babies for a living. I hope everybody has had a good holiday season thus far. If you had a baby who was in the NICU, I hope that you found a way to make it special so that you can celebrate and have those memories. As we're looking to go into the New Year's, again, I would encourage you for the same thing. If your baby's still going to be in the hospital, find a way, find something small and special that you can do to make it a memory for you. Please Like my Facebook page, check out my other videos, find me on Instagram, find me on Twitter, find me on Periscope, check out my YouTube channel. Thank you for listening. Please share, share, share. Sharing is caring. And I have some exciting things coming up in 2017, so please keep in touch with me to look forward for that. Thank you for tuning in. Bye.